Good afternoon, everyone, and welcome to this webinar on vaccinating our region, what businesses need to know. My name is Wendy Gramson. I'm President and CEO of the Toledo Regional Chamber of Commerce. And on behalf of the Chamber and those involved with the V Project, we want to welcome you this afternoon. The V Project is an area-wide initiative to educate, motivate, and vaccinate the entire Northwest Ohio region to dramatically slow the spread of the COVID-19 virus. I'm pleased to co-chair the V Project's Business and Industry Subcommittee, along with Christine Castellano from the Andersons and Doug Liedberg from Dana Corporation. The Toledo Regional Chamber of Commerce and the V Project are partnering today to host this virtual meeting, and we've assembled a panel of experts to provide an overview to help business leaders understand how to navigate the challenges and complexities associated with the vaccination process. Again, I would like to welcome over 350 business owners and leaders who are joining us on the webinar today. Before our panelists begin, I would like to welcome a few members of the media who have joined us today, and I want to let everyone know that the webinar is being recorded. It'll be saved on the Chamber's website for you to review and share at your leisure. As you will hear from our speakers, I also wanted to mention that there are many facets of the vaccination process and they are continually changing and being updated. So the information that you are about to hear is hot off the press and as of today, January 26th. So we do expect that things will be changing. At this time, I would like to introduce for some welcoming comments, the Mayor of the City of Toledo, Mr. Wade Kapsakevich. Mayor.
Thank you, Wendy, and thank all of you for participating in this webinar. The fact that there is such a large turnout is another indication, quite frankly, of the value that your chamber provides to you as members. So that's either a plug to pay your dues if you haven't yet, or to spread the word about the value of the good work the chamber does in communicating to the business community. And I can't think of a more important task ahead of us than getting this community vaccinated. Look, we're all sick of this. You know, we're sick of the masks. We're sick of the restrictions and the curfews and everything we've endured over the last year. And I want to get back. I want to go to Mud Hens games. I want to go see the walleye. We got a couple big golf tournaments coming to town this year. I want to eat in all your restaurants. Look at that waste. I want to eat in your restaurants and patronize your small businesses. So there's just one thing left to do to accomplish all that, and that is to get shots in arms. And what the V Project is very much a grassroots initiative, frankly, led by and conceived by some voices in the business community. We're going to hear from Sean Savage in a moment. Beginning with his advocacy and the leadership of some of the biggest businesses in town and small businesses and the diocese and schools and everyone. We're really banding together to try to get people to get vaccinated. And we know that there's a challenge ahead of us. We've seen the percentages. Not everyone feels comfortable about getting that vaccination. Some people sort of ideologically have heartburn. Let's be honest, there are some communities, minority communities, who rightfully remember the bad experiences of the Tuskegee experiments and some other things. So we got to get people to feel comfortable. One thing I know is that people, lo and behold, don't often trust when someone from government do something. So what we have done, what the V Project is all about, is bringing together voices in the private sector and in the community to pitch that message. So maybe you won't be compelled to get vaccinated if the mayor or your congressman tells you to, but maybe you'll do it if the coworker in the next cubicle tells you to do it, or your pastor, or the coach of your daughter's volleyball team, or whatever it may be. That's what this organization is all about, and we're really excited that you want to help us be a part of the solution. So thank you so much for your time, and thank the Chamber for organizing this.
Thank you, Mayor, for being with us. I know today with the funeral of Officer Stryker is a Stalker, sorry, is a very difficult day, and we appreciate you taking some time to be with us this afternoon. Next, I would like to introduce our Lucas County Commissioner, Tina Skelton Wozniak.
Thank you, Director Gramza, and Mayor Wade, and all of you who are on this call, and a pleasure to be with these panelists. And I was so happy that 350 plus people decided to be on this important seminar, and hopefully you'll get some of the tools that you feel that are beneficial as we move forward. I mean, basically that's what the V project is. It's us working collectively, and particularly with the business community, to find our way back. We all miss each other. We miss our chats at the water cooler. We all miss our time together to hear about our families and kids in the workplace, and we're looking forward to what point can we really feel that we've gotten everyone to a place of safety so we can go about our normal business. And we know people have been hurting through COVID, and we know businesses have been hurting through COVID. We know that businesses have had to learn new and creative ways in which to operate to be able to stay as strong as they want to be or have always been. So today's our day to learn more, and I think that's really what this COVID experience has been. And it's actually been about 1 year this coming February and March that we've all been handling this together, and we're certainly not quite out of the woods. But the vaccination program and the V projects, which will help with the delivery of the vaccinations, are what really are going to give us the tools that we need to get as many people as possible vaccinated so that we can have a healthy Toledo and a healthy community. Again, thank you to the Chamber. Working with you is always so important. Last year we had a brief encounter where we were able to work together for a small business stabilization program through COVID dollars that came from the state government through the CARES Act program, delivered from the federal government to the state. And we did what we could to help businesses with serving employees under 50 persons. And there's just so much to be done, but we're in it together, and we're going to stay committed until we have that herd immunity. Now we're excited that 75-year-olds this week are starting to be in the queue to be able to get the vaccination. And many healthcare workers have had a vaccination, and many vulnerable populations have received the vaccination. Certainly we know persons with mental illness and persons with developmental disabilities are in the queue also to get the vaccination. But I'm really proud of our community because we've all watched on national TV nightly news that people are standing in line or riding in their cars for 5 and 6 hours long in order to get their vaccination. I think Ohio's trying to be different, and I know Lucas County and Toledo are trying to do this differently so that you can get an appointment, you can go to your vaccination location, the many that are available to us in the community, and a half hour later, you can come and go and say, yay, I got my first shot, or I got my second shot. That's the goal, not to have people standing in lines and not sure if there'll be a vaccination at the end of that 5-hour wait. That's really the goal, I think, that we're trying to deliver and help out on. The county has more opportunities coming its way every so many weeks. There'll be dollars coming in to help people with the rental assistance program so people stay in their homes and continue to buy the goods that they need to be able to buy from our businesses in our community so they stay strong. Just one more tidbit. Our Emergency Operations Center remains open and in business. If you need troubleshooting, if you need help with particular business items or equipment, or how to get someone that is 70 plus when we reach that point vaccinated, we have people on the ground all the time able to solve problems. And I keep saying, don't be afraid to call Mayor Wade, don't be afraid to call Dr. Zagdinsky. Don't be afraid to call the commissioners. We're all here to work with you. And a major heads up and thank you to Sean Savage and the business community for doing what you're doing. Appreciate all your work.
Thank you, Commissioner. So before we get to our health professionals, we did want to give Sean Savage from Savage and Associates, who has really been, he's modest, so I'll say it. This was his idea. He rallied people together. Hopefully didn't have too much trouble talking us all into joining this project because it is very important. So he is the chair of the V Project Leadership Steering Committee, along with Pat Bowe from the Andersons. Sean, if you want to tell us a little bit more about the V Project.
Thank you, Wendy. And I appreciate everybody's participation today. And I really appreciate the Toledo Regional Chamber of Commerce partnering with the V Project. What a great audience. Soon it will become painfully apparent to you that I'm the least qualified person on this panel. So I'm told they asked me to present to make everyone else look especially good. So, but we have a really smart and talented group of presenters, so I won't stand in the way for very long. I'm going to lay out to you why we are doing this and the ways that you can help us achieve our goal. The V Project is victory over COVID-19 through vaccination. It's a grassroots community-wide initiative. We have broad representation from the business community, not-for-profit, healthcare, education, faith-based, and government. It is completely volunteer-driven. There'll be no public funds coming into the project, so it's going to be all privately funded. Collectively, we have a problem to fix. Vaccines are 95% effective. They're safe, as you're going to hear more about that soon. But 40 to 50% of the population is reluctant or against taking the vaccine. So as a society, I compare it to all of us as a society being in the middle of the ocean and we're drowning, and the helicopter comes above and drops a bunch of life jackets down, and about 40%, 4 out of 10 of us aren't willing to grab the life jacket yet. So our job is to get everybody reaching out for that life jacket. So that's what we're going to accomplish in the next few months. The businesses need our community to defeat COVID-19 so the wheels of commerce can turn at full capacity. As all of us know, that's not happening right now. So how do we fix the problem? We fix it really through education, through trusted leaders in the community. Those are trusted business leaders, trusted healthcare, trusted faith leaders, our not-for-profit leadership, our government leadership. So all of us are the solution. And the education is going to come through you to the rest of our community. The V Project is gathering the facts. We'll be disseminating them through you to those that you influence. So this will be written, it'll be visual, it'll be videos, it'll be public service announcements that we'll be producing and then getting out to your organizations in a way that you can easily disseminate it to your folks. So how can you help? So first of all, join the V Project by sending an email to me or a message through vproject.org. So vproject.org, you can send a message through that to have your business attached to the project. Please take the content that we deliver to you and get it to your organization and to your customers. Please take ownership of it. Put your own twist on it. You're all leaders out there, so make it your own and make sure you influence those that need to be influenced. Please lend your talent to the project. If you think about the project, all we are is we are the community. So we need everybody's areas of expertise. We're not turning down anyone for help, any offer for help. I was on a meeting this morning. We brought a new organization on board that wants to help, and they're going to really be able to help us. So we have a mountain to climb. If you would be willing to link vproject.org to your website so that everybody's kept up to date that way, we think that could be real helpful. If you can help, this is kind of a specialty thing, but if there's an issue with regard to transportation, we're very concerned about our community members who can't get to these vaccination sites to be vaccinated. So we're working on a more sophisticated transportation strategy. If you happen to be in that world and can help, please step up and give us that support. That would be appreciated. Another thing is the call center with United Way and 211 and the wonderful work they're doing. they are over capacity. They don't have enough capacity yet for the demand. And so, we're getting some help from the likes of AT&T and Verizon and other folks. But if you have a specialization in call centers and building those out and the expertise, please help us. That's going to be key to delivering for our customers. And then resources. So, no money, no mission is what you hear out there. So we do need resources. There's going to be a pin that when you get your second vaccination, you'll get a pin that's branded to this project, which means it's branded to our community. We're going to be spending money on that, marketing flyers, pamphlets, ads, social media buys, transportation, and other logistical support items. We're trying to raise $750,000. Not with, we don't have a full understanding of the demand and the need, but we know that there's items that need dollars. In the last 9 days since we started funding, we've raised about $150,000. So if you're in a position to support, if you're one of those businesses that's doing pretty well right now, please make that consideration. And you can go to vproject.org. One of the top tabs is how to give. So please do it. Kind of in closing, I just like to say we all tend to like to compete, and I look at our community as having a scoreboard for this. So if state of Ohio has done a wonderful job that, and we have it linked to our website where you can go in and hover over every county in the state. So you go to 88 counties and you can see what percentage of that community is vaccinated. And so far, we're off to a pretty good start in this neck of the woods. So I think Lucas County, last time I checked, was about in the top 10 of all counties, #1 in the higher populated counties. So we're beating Columbus, Cleveland, Cincinnati, Akron, you name it, we're winning. And we want to stay out there. And we also want to be one of the better vaccinated communities in the Midwest. And so we're going to really be tracking that. And we want you to track it. And we want everybody out there to go and pay attention to this, because that's how we're going to get to over 70% and herd immunity, is by, coming together as a community to get this done. So everybody's a customer of the V Project. That's the way we look at everybody in our community as a customer. We need to deliver for the customers, just like you in your businesses deliver for your customers every day. Once somebody makes a decision to get a vaccine, we need to make the delivery as easy as possible. We need to make it as easy as possible for them to get to the sites, and just make it user friendly. So we're, in closing, we're in a unique position in terms of history. This is unprecedented territory. And so I think you and I have a collective responsibility to our community. And I believe collectively, we will climb the mountain to the top and achieve victory over COVID. So thank you for saying yes to helping. You're saving lives and helping to move the community to a new and brighter day. So back to you, Wendy.
Great. Thank you, Sean, so much. Commissioner, there's a message in the Q&A that I just have to read for you. I won't say who it's from, but my 81-year-old parents were vaccinated at UTMC last week. They had 8 o'clock appointments and were done and back in the car at 8:29. Thank you for making it so easy for them. They were very worried they would have to stand in line a long time. Our health department is doing a great job. Thank you for, yes, it's working so far. We want to make sure that we continue to hear those sorts of comments. So we know that there are a lot of concerns. You have concerns as business owners, your employees have concerns. And so we've put together a great panel of health and scientific experts. I'm going to introduce all three of them, and they're just going to talk in succession and give their comments and their presentation. First, we have Dr. Eric Godzinski, the director of the Toledo Lucas County Health Department. Then we have Dr. Brian Kaminsky, Vice President of Quality and Patient Safety from ProMedica. And then we have Dr. Ike, who is an internal medicine specialist with Mercy Health. And they are all going to give us an update on the vaccine and the vaccine process. So Eric, I'll turn it over to you.
Thanks, Wendy. I appreciate it. Again, thank you, Sean, for getting us all together. This is amazing. You've done a marvelous job, and so I think the community owes you a debt of gratitude. I know the health department does for being able to, again, make this a lot easier than I ever thought it could be relative to getting the message out. I know we're only crawling right now, but I know when we start running, we will be leaders in the community. We will be leaders in the state and the nation. I just know it. It's the community, and it's all the business behind what's going on right now. Let's talk a little bit about the business and COVID, the business community and COVID. I think you heard today, you had a chance to listen to the governor, that again, we're looking at data, he's looking at data, and we're trying to, again, figure out how to get our businesses back up and running. And like the mayor said, get out and get out and eat, get out and shop and do those things we want to do. But again, we're trying to weigh this all out, and the governor does have a plan in place, and I'm happy to hear that today, because I was getting a little worried when we're going to be able to see the curfew lifted, how long is it going to take. But again, there's a plan in place now, and I don't want to go into a lot of the details. I don't want to mess up in the numbers, but again, at least there's a plan to lift the curfew, get us back to opening up businesses and being able to have those online at night. So again, it goes back to those numbers, and let's talk about our numbers here in Lucas County. I think the community needs to know that we are seeing a downward trend, and again, this is good. This is very good. We're still high. I don't want to say that we should be dancing around the table because we have low numbers, but we're still significantly above the 100 per 100,000. We're at 610 per 100,000. So, but we are seeing a trend down from where we were weeks ago, and even last week. So we see that happening. And why is that? It's because we are out there wearing our masks. We're doing those things we need to do in our community. Again, we know not everybody is taking this to heart. Again, there's many reasons behind that. But for the preponderance of our community, we are understanding that COVID is an issue. But we're also getting vaccinated. And again, that is truly why we're here. The vaccination process. Again, I know my staff hates when I say this, but the behind the scenes is like making sausage. It is grueling. Dr. Kaminsky's on. And again, what a great partner he is, as well as ProMedic and all the other hospitals, Mercy and UT and St. Luke's. We are all in this together, and we're working hard to make sure that we're delivering the vaccine quickly and effectively and efficiently, but it's not easy. That making sausage behind the scenes, there's trepidation of when vaccines coming in, because we're not notified till Tuesday night how much we're getting the next week. This week it's going to be Wednesday. So again, that puts an issue and a burn on us, because again, how do we get this out on Thursday like we want to quickly enough? Because there's all the scheduling behind it. I think that's what the community, the business community needs to know, is that the reason why we're not seeing 6 hours wait lines is because we are scheduled. We're taking the time on the front end to make sure that everybody has a time slot that they should show up in, which does make it easy, but we still have to sit for that 15 or 30 minutes after the vaccination. So even though we'd like to push people through faster, there's still the variable of having to wait to make sure that they don't have a reaction to the vaccine. I'm sure we can talk about that here more in a second, and we really haven't seen a lot of that yet. And I think too that's important to understand, is that the vaccine is truly safe. And so when we're trying to make this push out for these 80 or older, which we did last week, and now 75 and older, we're looking between us and the hospitals of about 4,050 vaccinations last week and again this week. So right now we have no schedules open. I'm trying to find some extra doses for the community, so we can push that to the hospitals and maybe open up some other schedules out there. But for right now, think about that. 8,000 individuals right now have been in the queue and or vaccinated in the last 2 weeks. Again, we are doing this, and we can do this. I think that's the most important thing, is that this community has the ability to get to that 70%. We just got to make sure that we're messaging that right. The behind the scenes actions, if you would, from all the hospitals, again, it is really, it's a resource drain. It truly is, trying to get these vaccines out, having to utilize their staff. We're doing the same thing in all these places. But again, we understand that this is the most important thing for our community, to get us back to working. Again, we hear about K through 12 now. Next week, that's going to start. And that is so important. Again, think about the cascading effect. If we can get kids back into school, parents can get back to work. We don't have to worry so much about daycare. Again, that whole issue of that cascading effect of getting kids back in school and getting people back to work in our community moving, it's so important. But the most important thing too is getting those kids back in school that they can start learning so that we don't have issues 5-10 years down the road with kids who might have missed too much school because again, we didn't get those vaccinations out. So again, the problem is it's limited. It is truly a resource that is so limited right now. We can't waste doses. We can't do this in a process that allows us not to vaccinate the right people at the right point in time. And the hospitals are being very diligent of that. The idea here is to make sure that every dose that we have gets into an arm, because every dose that gets into an arm is a win for Lucas County, it's a win for the state, it's a win for the United States. And again, that might seem very dramatic, but it's very true because again, if we can stop the virus from going from first person to person because of that vaccine, that means it doesn't go into somebody else, that's not infected to somebody else. They're not exposed. So again, these are all things that we need to do. We are just crawling right now with our number of vaccinations. I think Sean said we're around 6. I think I looked at this morning, I think we're 6.14% of our population is vaccinated. Not enough. The other thing that I think you heard the governor talk about today is the underserved. We've been trying to make plans to figure out how we get more vaccines into those underserved communities. As a matter of fact, I had a conversation with Donnie Miller today from an FQHC in our community, Neighborhood Health Association, as well as some other individuals. And so we're trying to figure out how to, again, capture some doses, get them out to those underserved areas in our community to make sure that our minority population, those underserved, are getting the doses that they need. We're going to continue to do this as long as we need to. We're here for the duration, much like I know Sean has talked about being here for the duration. We are going to do everything we possibly can to make sure that access to the vaccine is as much as possible. It's as easy as possible. The process that we have in place is as easy as possible. We're continuing to change things around every day relative to the system we have in place, because again, you have to critically every day look at that, reflect to see how you can change that system, and we do that. So you'll be seeing changes as we come through the next week or the next couple of weeks. But again, it goes back to, I think, what Sean is trying to do here is make sure that everybody's on the same page. We're moving forward and we're doing as much as we possibly can for the community. So Wendy, I think with that said, I'll turn that back over to you, and I think Brian's up next.
Yeah, Brian, go right ahead, please.
Okay, I'll jump right in. I'd like to thank you for having me. Thanks to Sean Savage for organizing this. I can't tell you how happy it makes me when I see a commercial on TV or something posted online that refers to the V Project's efforts. This is just a bonus for us, for all of us that live in this community. So thanks to everybody in the business world that's jumped in to help support this. And I think that we can attribute a lot of our increased success compared to other areas in the Ohio market because of Sean and his group and his efforts and everybody who's contributed to that. The other person I want to thank is Eric, the health commissioner. Most people probably don't realize this, but in the state of Ohio, there are hundreds upon hundreds of vaccine providers, and the state chose in each community a finite number of vaccine providers to deliver vaccines. So in our Lucas County area, there were 10 chosen. ProMedica's hospitals are one, Mercy's and UT and St. Luke's, and the health department was chosen as a vaccine provider. And so the path of least resistance would have been for Eric and his team to say, you know what, you're all providers, go for it and try to figure this out. But he didn't do that. He arranged for a coordinated effort for all vaccine providers, and we're using the health department scheduling software. So from the public's viewpoint, this is an easy process to get scheduled. Not every county, not every community is as lucky to have that. That's allowed us to move vaccine around where there are appointments available as opposed to those areas that have appointments full. And Eric himself personally has been coordinating a lot of that. So people might not realize what an added benefit that is to our community. And he and his team's willingness to step up and say, you know what, we're going to be the quarterbacks here. We're going to arrange for meetings with the healthcare providers, the vaccine providers, and we're going to share in this process. And we're all going to contribute because we're all in this together. So thanks to Eric and his team for doing that. I'm going to try to build on what he said and not try to be repetitious so that the information is fresh, but that does require me to shoot from the hip a little bit. So I'll ask you all to be a little bit forgiving as I talk a little bit about the vaccine. The first thing thing I want to talk about is the macro level. So when you look at the amount of vaccine that's been delivered across the country, as of yesterday, we had delivered somewhere in the order of 22 million doses across the country. There has been some concern about safety, and if you know somebody or have a friend or a family member that still might be on the fence, what I would encourage you to do is to not tell them that they're wrong, but to try to understand those concerns, because if we can understand where they're coming from, it's easier to address those concerns and easier to talk to them upfront and out in the open, and maybe help do some things or say some things to eventually assuage those concerns for people who might be on the fence. But the reality is, when we vaccinate 22 million people and don't see any significant severe adverse reactions, this absolutely is a safe vaccine. At ProMedica, we vaccinated over 13,000 of our employees already. We have had reported events, so it's somewhere in the order of about 150 events. None of them have been reported as severe. And the actual incidence of severe anaphylaxis related to this dose with this vaccine, which is the worst thing that we worry about, is about 2.5 per million. So I think that all just underscores the safety of this vaccine. So we have done enough of this locally. We've done enough of it across the state. We've done enough of it across the country to really have a high degree of confidence when we go out there at our stamp of approval and say, you know what, I'm getting, or I've received the vaccine, and I fully believe it is a safe endeavor to partake in. And everybody who's on this call, and the experts, and everybody that we interact with, we all have a circle of influence. So by verbally, promoting acceptance of vaccine and then receiving the vaccine ourselves really helps promote that level of people, or that percentage of people that will eventually accept the vaccine. We're about at 60% at ProMedica. That's higher than the national average when it comes to healthcare, but we're not done yet. We want to get that higher, and we want to partner with other organizations in our community so that everybody benefits and we get to that 70% threshold that we all want, or higher. As far as COVID statistics go, Eric talked about how we are on a downward trend, and that really is a good thing, because we've had week over week decreases in the number of hospitalized patients, which is one of our best benchmarks. But we're by no means over the pandemic, and having these new strains that are potentially more contagious, when you look at the computer models there, that does show the potential for another surge related to that. So that just underscores the importance of getting the vaccination as well. It's also important to mention that even though the numbers are going down and we're all starting to feel a little bit better about that, as of today, right now, we have more admitted patients in our hospitals across the ProMedica system than we did at the peak of the first wave of the pandemic. So that can just give you perspective of where we are right now. This is still a severe illness. It's still placing strain and burden on the healthcare system. We definitely want to see that number to continue to go down. But again, vaccination and adhering to those preventative measures really is the key. The other thing that's a good early indicator that really is a number that you can look at ahead of hospitalizations and definitely ahead of mortality is our percent positivity. And that has dropped pretty significantly in the last few weeks too. So that's a good indicator that the next several weeks to come, we should be able to continue to expect that downward trend. Again, it's dependent on people receiving vaccines, adhering to the preventive measures, and hopefully staying away from some of these new contagious variants and having them affect our area directly. The other thing that is really important to emphasize is the idea of vaccine promotion. The reason that you might see me on on TV, on the news stations, or appearing in a printed article or on the radio is that we really feel as an organization that it's our job to go out there and promote acceptance of the vaccine. And the best way we can do that is by sharing personal stories, sharing information about our system, sharing facts, sharing data, talking about current trends. And so we think it's all these things that eventually lead to increased acceptance of the vaccine and a greater percentage of our population vaccinated. The other thing that people are talking about right now, and that you might hear as they receive the vaccine, is vaccine-related symptoms. So as you know more people that have been vaccinated, they might start to talk about the symptoms that they encountered after receiving the vaccine. The good news is that the data is showing us, and our own personal experience is showing us, that number one, the symptoms aren't severe, and number two, they're very limited in time, usually only a day or so of the muscle aches, the fatigue, the headache, the generalized weakness. If somebody receives the vaccine and they actually start to have COVID symptoms, and what I mean by that is cough, loss of taste and smell, those type of things, that's actually not related to the vaccine. So in our system, what we do is we distinguish between what are anticipated vaccine-related symptoms and those that are more likely to be caused by the disease itself or something else. And we're able to separate those two, but do expect people to have some generalized fatigue and soreness and low-grade fever and muscle aches and body aches a day or two after it, but it's really a self-limited thing and goes away quickly. And most people tolerate it well, and many of our employees continue to work if they're just signs and symptoms related to the vaccine. I myself have received both doses of the Pfizer, and fortunately for me, it was an extremely uneventful experience. I had a little arm soreness. I would say it was really just about the same soreness that you would have with a tetanus shot. That occurred with both doses. I did not have a fever. I did not have generalized aches or fatigues, but those things are happening. And they are happening in a minority of people. More people have the symptoms that I experienced, which is very minimal arm soreness, and then that resolves in just a few days. So if there's anything else you can all think to do to positively encourage people to receive the vaccine, that's the attitude that you want to take, and we'll continue to promote it. And again, thanks to everybody who has made an effort here and stepped up and volunteered their time and helped with this care coordination. We really appreciate it. And I'll turn it over to Dr. Reich, I believe.
Yes.
Thank you so much for having me. I thank the team for putting this together and for inviting me to speak today. So just to continue with what Brian said, which I think is important, the way I have gone about the vaccine and speaking with patients and staff and community in general about this is to address the issues. And I have looked at it in three buckets. So there are three buckets that we have to address, and we have to be honest and acknowledge realities of that in order to encourage people to take the vaccine. Number one is distrust in government programs. And we know when we look at the community of color, the Tuskegee mayor mentioned about that program was a big one. And we cannot kind of cover that up and continue to move forward and pretend that nothing happened. So we start with that. I think that's the first starting point, is to acknowledge that something wrong did happen. But the good thing is, just as we have changed and came a long way in other areas in our society, there's been a lot of standards put in place to prevent such event from happening. So we have to acknowledge that first. And I always start with that. Then the second issue that I see people complain about is the speed of the vaccine, how fast the vaccine was developed. And again, as Brian said, it's quick for us to discount concerns of people. Again, it's important to acknowledge that. And I tell them that, yes, you're correct. It was developed within a year compared to other vaccines that takes 4 to 7 or even 10 years to develop. But another thing I also like to emphasize is we have to also acknowledge the advances in technology. If we look at the cars we drive and the safety and all the gadgets in the car, that wasn't there 10 years ago. When we look at the smartphones we have today, 10 years ago, we didn't have that. So the advances in technology has allowed us to make the vaccine very fast. And also the big elephant also being the fact that we don't have time. We don't have 10 years or 5 years to wait to develop vaccines that are actively killing people. So the need for us to develop vaccine fast is important. But again, the other point I like to make with that is the safety part of it. That in the process of developing the vaccine, there are a lot of safety put in place to make sure that the vaccine was done in a right way. Yes, there's some pharmaceutical companies that developed this, but between the pharmaceutical company and the FDA that are involved in approving this, we know there is also independent body of scientists and doctors that practice in the community that came to review the data. So there are standards put in place to make sure that the vaccine is safe. And at Mercy, we're giving more than 10,000 vaccines, and up to date, I haven't heard or received any complaint in terms of severe adverse effect. Another question I've gotten is, Pfizer versus Moderna, which one is the right one to get? And I tell patients that it's okay to get anyone that is available to you. It's okay to get that. And the reason I said that is also looking at the data are almost similar. When I was scheduled initially to get my vaccine, it happens that when they looked, it was the Pfizer. When they looked, the next time I'm supposed to come get the second dose, I will be out of town. So because of that, I didn't get that. And then I was scheduled to get the Moderna, which I did on the 19th of December. And then 19th of this month, I went back and got my second dose. The first dose went well. I didn't have any symptoms. The second, yes, I had fever and malaise. I didn't have any respiratory symptoms like cough or sore throat, loss of taste, anything like that. It was more of just a general feeling of not feeling well and a low-grade fever, which resolved within 36 hours. So again, these are the things that I like to emphasize when I speak to patients, and I hope everybody can pick one or two things in there to emphasize. And finally, is the effectiveness. Is this vaccine effective? Again, looking at the data, we know that it is effective. Both of them are in the 94-95% effectiveness compared to other vaccines that we know we have that are effective about 70% of the time. So data have shown that this is effective. It is safe. And of course, we recognize the speed of the vaccine, but knowing the advances in technology that we have and all the processes put in place to make sure that it's safe, and looking at the data, I have been an advocate and encouraged that not only our staff, but patients and our community get involved in taking this. So thank you for having me. I appreciate the time.
Great, thank you, Dr. Ike. I know we are having some questions come in, both the Q&A and the chat. We'll try to get to as many of those as we can, but we also are recording this session, and so that means we will be able to go back, look at questions, or route them to the right panelist and get those questions answered for you. So we'll try to get to those if we can. To round out our panel, though, we want to hear from an employment attorney, Amy Luck from RCO Law. She's going to provide an overview of the things that employers, I know you have a lot of questions. I think she's probably anticipating what some of those are, and you may have some others, but please welcome Amy Luck. Amy, I'll turn it over to you.
Thank you, Wendy. I'm going to share my screen. Julie, are we ready to do that? Okay. Can everybody see the PowerPoint? Great, thank you. Okay, well, I think a lot of you employers are probably trying to figure out whether you can or should make the vaccine mandatory with your employees, or whether you're going to go the right route of making it a voluntary exercise. I think this depends on your workforce and how much exposure your workforce has with clients, patients, and customers. I think you need to when you think about healthcare workers, you can hear already that many of the healthcare workers as part of the panel have already received their vaccination. That's the type of business that is more likely to be able to make the vaccine mandatory. Some other examples include employees that are exposed to vulnerable populations, folks who work in nursing homes, for example, and also correctional institutions, for example. Essential workers may fit into this category, but I think once you get away from that healthcare worker category, you need to think about whether it's worth it to require that your employees get the vaccine, because it will have an effect on employee morale. You need to think about what will you do when people want to say no. There are two exemptions that the EEOC has identified. The first is disability, and the second is the religious exemption. When it comes to the disability exemption, this has to be based on an established disability as defined by the ADA or in the Ohio Civil Rights Act. And you need to, just like all of the HR folks that I talk to every day, they are familiar with engaging in that interactive process with the individual and trying to figure out what kind of reasonable accommodation you can provide them. You can, as an employer, request proof of their disability if it's not already obvious or if you didn't know about it. That kind of proof can come in the form of like a doctor's note. Sometimes a prescription or a health insurance record. And you can refuse an accommodation, but in this category, only refuse the accommodation if you find that this is a direct threat. And that's a high bar under the law, that direct threat due to a significant risk of substantial harm to the health or safety of the individual or others that cannot be eliminated or reduced by reasonable accommodation. So it's going to be a very rare occurrence that you're going to be able to find that you can refuse an accommodation and find that you have an undue hardship, which in this case is significant difficulty or expense. So do your best to work around those reasonable requests for accommodation, and you may find that you're already providing them. As to that direct threat, you need to do an individualized assessment. These are the 4 factors that the EEOC has identified, including the duration of the risk, the nature and severity of the potential harm, the likelihood that the potential harm will occur, and the imminence of the potential harm. One example that people are identifying is that duration of the risk. If you have an employee who's pregnant, for example, the duration of that risk, if that employee is resistant or has not been allowed to take the vaccine, or their doctor says don't do it because it hasn't been cleared yet, the duration of that person's risk is going to be limited. So you may be able to find a reasonable accommodation for that person through the end of the pregnancy, and then after that, they'll be available to take the vaccine. With respect to the religious exemption, this is based on a sincerely held religious belief, practice, or observance that equates to traditional religious views. You may already have some folks in your workplace who have requested accommodations based on their religious beliefs. The same and a very similar analysis applies. You need to work through what reasonable accommodations you can provide, and you can refuse that accommodation if it poses an undue hardship to your business. Here, that undue hardship threshold is lower. It means it's more than a de minimis cost or burden on the employer. So it's a little bit easier on the employer to refuse an accommodation under these circumstances, but you still need to explore everything. And again, you can request supporting information about why their religious belief prevents them from getting the vaccine. Reasonable accommodations. You likely are providing a lot of these already. Everybody's wearing masks, sometimes using gloves. You may be providing PPE. A lot of us have learned to work remotely, and you can probably continue to do that through an extended time period for a lot of your workforce as an accommodation. You can also work with scheduling folks on alternating schedules or reassigning somebody to a less populated work site if they have resisted or are unable to get the vaccine. You need to also continue to have everybody wear their mask and social distance and follow those rules like we have been all along. The EEOC has specifically identified political beliefs as not reasons to request an accommodation. So if you need to point to a reason why you can't accommodate based on a political belief, you have data to suggest that, and from the EEOC. And as HR folks always know too, document all those requests for accommodation. Write down when you met with the person, what their requested accommodation might be, what your counter proposal was that would work better for the business, and what you guys agreed upon, and what the plan is. Those are going to be helpful to you in the future. You could also say, you know, if the reasonable accommodation is having that person be allowed to continue to work remotely, but you want that to be a temporary plan, say so and put it on paper, and then everybody knows what to expect in the future. So most of you are probably in the category of allowing folks to be voluntarily vaccinated. One thing you should know is the administration of the vaccination is not a medical exam as defined under the ADA, but those pre-screening questions might implicate the ADA or GINA, which is the Genetic Information Non-Discrimination Act. So as an employer, you want to stay as far away from conducting those pre-screening questions or having knowledge of what those answers are. And remember that assuming that you are allowing employees to voluntarily vaccinate, their decision to answer those pre-screening questions has also got to be voluntary. And if they refuse to answer pre-screening questions, if you're in charge of administering, like for example, if you're hosting a vaccination clinic on site, and they're refusing to answer those questions, you can refuse to provide the vaccine, but you can't retaliate against them for refusing to answer those questions. So what can you do? You can request proof of the vaccination. That is usually I think that's going to be in the form of a short, a card that says your name and when you got vaccinated, when your first shot was, maybe when your second shot was, but that's it. Don't ask, why didn't you get vaccinated? Because then you may have implicated the ADA or GINA and you'll get yourself in trouble. You can also encourage vaccinations by covering their cost, hosting one of those vaccination clinics on site, or if you arrange for a third party to do this, you can provide people with time off, paid or otherwise, to go get their vaccination at a pharmacy or other location. You can offer incentives, but I want to throw a lot of caution with this. This is de minimis incentives only, which doesn't account for much. So be very careful if you're offering incentives to get vaccinated. I think one of the best solutions is either to have the vaccine clinic on site, and if you're doing that, work with your local health department to set that up, or arrange for a third party to administer and ask those pre-screening questions, and make sure that third party doesn't have any obligation, or you have an agreement that they won't share with you those pre-screening answers, so that you can't know what those are and you won't be in trouble for in any way for discrimination based on that knowledge. I think that's all.
Great, thanks, Amy. And I want to thank all of our panelists today. I'm going to try to jump in and ask some of these questions in maybe a little bit more consolidated way, but I think it'll get to folks' questions. The first one was something that Amy mentioned. The question actually came from a church, but I think there are some businesses that are also wondering. And I know things have changed in terms of the sites where people will be able to get vaccinated. So I know that's a moving target a little bit, but if you could just, Eric, mention, are you going to have some closed sites? What might that look like?
Sure. I think you might know we actually pivoted within 72 hours of our planning that we've done for the last 2 decades to what the governor has asked us to do with these providers. And I know Dr. Kaminsky's been involved with these closed pods, open pods planning. So right now, we're going by what the governor wants to do, and these multiple providers, I think they're going to grow over the coming weeks and months eventually. We are still looking at the backup plan of opening up these pods. Again, if we haven't contacted you, just give us a little bit of time to figure out how this is all going to work, and we'll probably come back around with you. I will tell you this: just because this happened this way for this pandemic, we still need to plan for the next pandemic, which will come. So we'll probably come back around to that as well too, with closed and open pods.
Great, thank you, Eric. The next question is, do you think the rollout of the vaccine is going to continue to go in 5-year increments?
Yeah, for right now, I know we'll get down to 65 and above. And please remember what we're looking at. So when we do hit that 65 week, that doesn't mean that it's just 65. It's 65, it's 70, 75, and 80, as well as all those other individuals in that 1B group we have right now. I don't know if the governor's going to continue that on for a couple of weeks. In other words, we're going to stay in that 65 and above group. I think they're still trying to work that out, depending on how many vaccines are coming in. But for right now, it's going to be 65 and above, and eventually in the next 2 weeks. And again, just listen to the media, watch for scheduling, and we're going to get all those vaccines out to those individuals that we can.
Great, thank you. These next couple of questions are for our healthcare professionals. And I have to read this one because I'm not sure what it means exactly, but we've seen concerns from healthcare workers that people administering the vaccines are not using the IM injection protocol. They're using a Z-track method or the Z-track method. Instead, they're pinching the skin as you would with the sub-Q injection. We see this example being shown when we see people being vaccinated on television, our staff being trained to give the injection correctly. Yes.
I could start, and then maybe Dr. Ike could add in with his own personal experience. For me, that's actually the first time I've heard that concern, and I've been around the vaccination sites. I've received them myself, and I've also talked to a lot of people that have received their vaccination. So I haven't heard that come up. Is it possible? It's certainly possible that there are some technique issues. This is a brand new process for all of us. So although we've been able to stand up a number of vaccine clinics, what people haven't seen is the behind the scene work that has taken to put those together. So we definitely have qualified individuals doing that, and there's a lot of things that they're doing at the same time, so many spinning plates by the time each person walks in, and that's good feedback to have. I'll take it back to our team at ProMedica and just say that's something that's out there that we're hearing, and see if that generates some additional conversation on our end. But I haven't observed it, haven't heard of it, but certainly recognize that those type of things could be possible.
Okay.
Yeah,
Dr.
I will
Ike,
add. I'll add. Thanks for the feedback. Again, I do echo what Brian said. It's most of the staff doing this have experience in giving vaccines in the past, so this wasn't their first rodeo doing vaccination. But your feedback is important, and it's something I'll take back and review with our team and make sure that things are being done in the right way.
great. Still some health care related questions. Are people still contagious after they've been vaccinated?
I don't mind starting there again, and because it's one that I get a lot. And so if we go back to the beginning and talk about the safety and efficacy of this vaccine, and as Dr. Ike pointed out, both vaccines, the Moderna and the Pfizer, which are the vaccines that we have now, are about 94, 95% effective, which is excellent. It's better than we would have predicted going into that. We didn't ever say that they were 100%, so that leaves 5% out there. So 5% of people that receive the vaccine still are susceptible to getting COVID and getting sick from it. And if they do get sick from it, then they're contagious like everybody else. We can't predict who that's going to be. So that question usually, in my experience, leads to the other question, which is, once I have my vaccine, can I stop wearing my mask and can I stop following all these procedures we've had to do for the last year? And my answer is unequivocally no for right now, because number one, of that 5% that, we know still creates vulnerability. And number two, any recommendations that are going to come from our healthcare experts and from our systems are going to be made based on disease prevalence. And so the less disease that we see out there will lead to reasonable and incremental loosening of restrictions as we feel more confident that less virus is out there circulating in the community. So I think the name of the game here is to continue to do as much as we reasonably can while we're vaccinating people, so that we can really drive the virus out and have excellent results, instead of just giving up a few of these measures that we know already work while we're doing the vaccine. So it's going to be related to the amount of disease that's out there, the percentage of people that have been vaccinated.
Okay, great. And then have any of the long-term effects, obviously there hasn't been time to study that, but is there anything that you're kind of anticipating or looking out for?
Right. Dr. Kaminsky?
Sure, I'll start there. I think that question is a really good one, and it also comes along, in my experience, with a lot of myths about the vaccine itself. So one thing I hear that usually comes along with that question is it going to affect my DNA, and am I going to, grow a third arm, 3 years down the road? Or some people have concerns about, is this, carcinogenic? Is this something that could, create, some major problem with my genetic material? And the answer there, although we haven't done the long-term studies just because that time has not elapsed, we feel very confident that that's extremely unlikely, because the mRNA vaccine actually never makes its way into your genetic code. So it doesn't cross that nuclear membrane in your cells. It stays at a level in the cell where your proteins are manufactured, and actually has your own cells producing the protein that your immune system recognizes on the surface of the virus, and it never enters your own genetic code or your chromosomes or your operating system in your body. So we believe that long-term effects are going to be extremely minimal. And what we've seen from other vaccines, that if you're going to have a reaction, by far and away, most of the reactions are immediate. And for those that aren't immediate, it's usually 1 to 2 months that you're going to see a problem related to vaccine administration. And we're now into that 1 or 2 month period, and we're still not seeing it. So this just gives us more confidence to believe that the vaccine is safe and effective. And based on other vaccines that we see, the likelihood of long-term ramifications just gets smaller the more time that elapses.
Okay, 2 more quick questions, if I can. How long after you've actually been diagnosed with COVID should you wait to get the vaccine? And then along with that, if you've tested positive for antibodies, do you still need to be vaccinated?
Yeah, I'll give a crack at that, and then maybe Dr. Ike can fact check me or fill in any gaps that
Sure.
I had. Those are 2 really common questions that I get. The first is that, we get a lot of people that have had COVID and are wondering if they should get the vaccine. And there is mixed advice out there. If you look at the CDC's website, that has actually changed over time. So initially what they had said was that if you want to wait, it's optional to wait 90 days, because we know that immunity lasts at least 90 days, and your likelihood of getting it twice is extremely low. But on balance, there are other things that are very positive when it comes to receiving the vaccine, especially those priority groups. So when you look at healthcare providers and people who are part of groups that have a circle of influence, I think the public message of receiving the vaccine, even if you have had COVID, goes a long way for creating positivity and acceptance of the vaccine itself. And you're eligible to receive the vaccine as soon as 10 days after you've come down with symptoms, as long as you're considered recovered. So if You receive the vaccine. I mean, if you have COVID and go through your 10 days, and at the end of that 10 days have been fever-free for 24 hours and have had improvement of your symptoms, you can receive your vaccine at that point. And then I think your second question was related to antibodies. When the antibody test first came out, we didn't know how much information it was going to tell us. We were optimistic that it might give us some indication on long-term immunity. But what we're learning now is that the antibody response that we get after getting COVID is actually fairly limited. And in many people, especially those people with less severe symptoms, that antibody response fades very rapidly. So we have plenty of people out there in our health system, in this community, that have had COVID. They want to go donate their plasma to help other patients with COVID, and they go to get their antibodies checked, and they find that they don't have measurable amounts of antibodies. That doesn't necessarily mean that they're now more susceptible, because we can't measure that. There's just so much that we don't know, but we do believe the immune system response to COVID is just a lot more complex than the antibodies alone. So we have memory cells, we have killer T cells. All these things play a role in combating the COVID virus. And we think that in this case, that it's less dependent on antibodies directly and more dependent on some of these other immune mechanisms that convey the long-term immunity, speaking of 90 days, that we're observing right now. So it's a lot more about antibodies. We know that they fade quickly. And so the presence or absence of antibodies really doesn't give us a lot of good information, unfortunately.
Okay,
What I do,
thank you.
Dr. Ike?
You said it well. There's nothing else I need to add to that.
Great. The last question then, because we are a bit over our time, there's just a question about, is the thing to do, again, if you're in that upper age range, to be pre-registering with the health department? I know there was some fear that when we went from the health department site to all these other sites that we signed up for nothing. But that's not the case. I know people that signed up through that, got their appointments, and things seem to be going well. So I think the answer to that is yes.
Yeah,
but I'll let you answer it.
Still keep on using that pre-registration notification link if we can. You're going to have to register again, of course, with that link to take you to the hospital or wherever you're going to go for your vaccination. The thing about the pre-registration notification is that we can have immediate contact with you to let you know what's happening. Even like our K through 12 that we have on that pre-notification list or pre-registration notification list, we're going to be able to get out information to them about their vaccinations for next week. So it truly is a great tool to use, but it's not the only tool.
Great. Well, thank you to our panelists and everyone that's been on the webinar. Like I said, it is recorded. It'll be on the website. We'll put it on both the Chamber and the V Project, so you can find it in either place, along with the answers to maybe a couple of the questions that we didn't get to. Or perhaps we'll put a frequently asked question page up there if that's not already on all the sites. But so I guess the other thing is just to mention, we are going to have more of these webinars that will get a little bit more into the detail. Maybe we'll really have some smaller groups where employers can talk about, hey, how are you incentivizing your employees? How did you decide whether or not to make it mandatory? So we'll be doing some more of those as well. And also, perhaps this worked well when we did the reopening. We'll do some industry-specific roundtables. So like-minded companies that have shifts, can kind of all talk together about how that's working best for them. So again, important thing is, what we can do as employers and individuals is get vaccinated. We all want to get back to normal. I was saying to the mayor and a few others in the beginning, I haven't had a curfew since I was in my early teens. And I guess my parents weren't very strict because I never had a 10 o'clock curfew. So it's very strange now to be much older and have a 10 o'clock curfew. So those are one of the things that we're anxiously awaiting. And I know businesses are, for sure, the restaurants and those types of businesses are anxiously awaiting the lift of that curfew. So this is what we can do to make that happen more quickly. So appreciate everybody's participation. Sean, thank you so much for starting V Project. I think it really is going to propel our community to be, one of those top vaccinated communities. So we really appreciate all of your work as a volunteer in herding the cats, if you will. Again, thank you very much on behalf of the Chamber and the V Project. If you have any additional questions, be sure to contact either the health department, the V Project, or the chamber. Have a great evening.